rid of that stubborn fat but don't know where to start? Well, there are so many claims and products that so little works. Dr. Bill Johnson of Innovations Medical is here to separate fact from fiction about fat. Dr. Bill, how are you today?
Good morning.
All right, let's talk about all those procedures and pills and creams and even patches that claim to get rid of fat. That's a myth.
There's a lot of that out there, and it's all a myth. There's not a pill that can make you lose weight. There's not a pill that can particularly make you lose weight in a particular area. There's nothing that can take it off your belly or take it off your thighs. The gold standard for taking fat away from a particular area is still liposuction.
Okay.
And the newer techniques that we use where we do really good jobs with skin tightening, get much smoother results. So liposuction remains the standard. Now, that said, there are a couple of new techniques like Liposonix,
right,
which can destroy fat permanently in a particular area. So if you want to lose a little bit in your thighs or lose a little bit in your tummy, Liposonix uses focused ultrasound to permanently get rid of those cells. And once they're gone, they can't come back. So that's a good option that really does work where the pills and creams or patches don't.
Okay, Liposonix, and it bears repeating, it is really cool technology.
Yeah, it's a really groundbreaking technology and is going to, over the next 2 or 3 years, have increasing applications.
That's great. Okay, well, let's talk about another myth, because so many people think that liposuction is just for the rich and famous.
Yeah, you know, that has some truth in the past, but nowadays we do liposuction in the office under local anesthesia. So we don't need a hospital, we don't need a surgical center, we don't need an anesthesiologist. The recovery is much quicker. It doesn't require nearly as much personnel time. So all of that has combined to make liposuction much more affordable.
Okay.
So we can do your abdomen or your love handles for $3,000 to $5,000 depending on how much we're doing. And it has really come down to very affordable rates where folks can really take advantage of it now that couldn't in the past.
Okay, let's talk about another myth, because when we talk about fat transfer, people think once you do that fat transfer, it only lasts maybe up to a year.
Yeah, and that's also no longer true. We have experience out about 10 to 15 years now, so we know it lasts that long, but most experts agree that once the fat is taken up its new home, it's there forever. It's there for good.
Okay.
And so the real issue is making sure that it can get established in its new home. So that's all about the technique of harvesting the fat and how we lay the fat in. And so we're seeing really good results. 50 to 70% of the cells respond to current techniques, and then we can use additives like platelet-rich plasma,
right,
which are PRP, which has a lot of growth factors that your body uses to help bring in and promote healing. And with PRP, we're seeing up to 90% cell survival, and then those cells are for good. They're permanent.
We've talked about they send text messages to each other.
It's kind of like with the PRP, we're kind of like telling the body text messages to say, hey, these cells need help, and it really helps make the fat survive. Okay,
and a big popular place to get that fat transfer is for breast augmentation, which has been very successful, but there's a myth that it interferes with mammograms.
Yes, and that may have been true 25 years ago.
Okay.
When, with older techniques, when the fat would tend to die and leave calcium, or older mammograms, that really was true. But nowadays, modern techniques, very little calcium. Modern mammograms just don't have any trouble seeing it.
Okay, I know we didn't get to your specials for GMT viewers, but I know you always have them quickly. You want to add?
30% off Liposonix between now and the end of the month. So
30% off. We like that.
Great deal.
Great discount. Dr. Bill, thanks so much. And if you want to find out more information, innovationsmedical.com is the website. For the Dallas location, it's 214-420-7970. Over in Fort Worth, call 817-744-7901. And as always, if you have a question for Dr. Bill Johnson, drop him an email, questions@innovationsmedical.com. Carrie?